Hi, so I'm here today with Kendra Mathys. She is a clinical psychologist in our building here, and I was excited to see her wellness sign go up because I'm all about wellness and I love to get in touch with people who are practicing nearby. So I was very excited to see when you showed up, and I just wanted to bring her in today to chat a little bit about the importance of emotional health and kind of tie in the greater picture of wellness and what that means.
Well, thank you. I'm happy to be here. I'm happy to talk a little bit more about emotional health and how it fits in.
Awesome.
So I am a clinical psychologist in private practice. I've been in private practice for about 4 years now. And some of the main issues I see are things like anxiety and depression, also eating concerns, all of which have such a huge physical component to them as well.
Yeah, totally. We actually were just talking a little bit about, well, tell us a little bit about what kind of techniques you use and what kind of what drives you, what's your passion behind psychology?
Sure. So I primarily use cognitive behavioral therapy, or CBT for short. And the main principle behind that is how closely connected our thoughts, our emotions, and our behaviors are. And so in order to work at that emotional aspect of it, we can address both the unhelpful negative thoughts that are there, as well as the unhelpful behaviors that contribute to it, as well as developing healthy coping strategies in order to manage emotions a bit better.
It's so true that our thoughts lead to our actions. So healthy thoughts lead to healthy actions. Unhealthy thoughts lead to unhealthy actions, and every time, it's so true.
It sounds so simple, but it is such a new skill for everybody. I think we don't normally stop and think about our thoughts the way we're thinking and how it contributes to how we feel, but it does make such a difference once we're able to first identify in the moment when those unhelpful thoughts are going on, and then learn how to take a step back from that to see the situation a bit more clearly and balanced, and then respond to it differently.
Yeah, I know a lot of my patients that I see regularly are making important, I teach them about physical stressors, chemical stressors, and emotional stressors. And I say, I'm here to help you with the first two, but the last one is so important, but it's sort of my missing piece. And so for physical stressors, they're getting adjusted, they're getting massaged, they're getting their bodies well taken care of and getting their pain way down, which is so important. With the chemical stressors, they're making such important choices with the beverages they eat, the products they use, the diet that they, whether they're eating inflammatory foods with tons of chemicals and preservatives, or they're eating like whole food and clean eating based living, really very simple changes to make that make a huge impact. But the one thing I think that is so hard for many of them is that they, there's all these things happening outside of their control. Like if a spouse is sick, or a kid is going through something, or a marriage is going through a rocky time, or if they struggle with anxiety and depression, there's so many things that feel sort of out of their control and are they just throw a wrench in the mix, and like this time of year, I know people are like, great, I have to spend time with my family. And some of us are blessed and excited for that. Others of us are like,
it can be a really challenging time of year for a lot of people.
Yeah. And so it sounds like the cognitive behavioral therapy and just a little bit of assistance along the way really could help just about anybody.
Definitely. I think there are skills that can certainly help all of us and all of the stressors we face throughout our life. So whether that is relationships, difficulties at work, managing stress in general, it can be adapted to whatever the person's individual concerns are.
Right. And even if you feel like, well, I get my 8 hours of sleep, I take all the supplements Dr. Sara says, and I get adjusted. And, with a lot of people, Kendra and I were just talking about gut health and the importance of gut health with anxiety and depression, and how it plays a huge role in how much serotonin your body can make. And so, even if we feel like we're doing everything we can, you have a very long, extensive degree and training in this, because it's not just something that comes naturally to everybody, because it is something that requires work and practice and can just really, I think, be that last little
the missing piece to the puzzle.
Totally. And I think it's funny, we as a society are kind of like, we don't want to really deal with our stress. We don't want to talk about it. We'd rather suppress it. We'd rather ignore it sometimes. I don't know. Do you find that that's the norm, or do you think people are coming around and willing to talk more?
It's starting to change a little bit, especially with some of the younger adults I see, who are in college or recently out of college. But certainly there has been a long stigma against mental health and talking about concerns and this idea of I should be able to handle it on my own. I shouldn't talk about these problems. So I think it's starting to change, but it's definitely deeply ingrained.
Yeah, and I think so it's natural to want to reach out. And so like if you're upset and are going through something, a lot of us will say, especially women, I think, and probably some men too, but I think we'll reach out to a friend or a family member or something like that. And so it's like we yearn for that assistance, you know, but we're going to someone with no training who has issues of their own that they're working through. And that's tough too. So it's a good thing to reach out to someone who has training, you know, who has the skills to help you kind of get there.
Definitely. That's what I hear from a lot of people I do see is that, you know, they don't want to burden, you know, their friends or family, that they want someone objective who they know can handle kind of hearing about all of these difficulties. So it is that kind of outside perspective with kind of the training behind it.
Yeah. So she is seeing patients here currently in Lakewood, right across the hall from me, which I'm so excited about. And you accept some insurances, right?
So I am in network with Cigna, Medical Mutual, United Healthcare, SummaCare, and Medicare.
There we go. That's a lot. So, and then what it would be the best way for someone to get a hold of you if they wanted to make an appointment?
So I can be reached at my phone number, which is
write it in the comments.
Yes, 440-202-1708.
We might have to say it one more time.
440-202-1708.
Okay.
Or you can visit my website, which is lakewood-wellness.com.
There we go. So you can find that now in the comments, and I'm sure she would love to hear from you. And so Kendra, fun fact, and I didn't tell her I was going to say this, but she just had her first, at least, introduction to a chiropractic adjustment like minutes ago, which is so fun. So we relaxed your shoulder muscles a little bit. So if you want to share anything, it's different.
Yeah, so I'm feeling definitely a little bit more relaxed, kind of looser in my shoulders, which is where I tend to hold my stress.
Yeah.
So even after just a quick little intro, I notice a difference.
Very cool, thanks. So I did want to give her an opportunity to see what I believe is just magical, which is chiropractic. So thanks for coming over again today. And basically just know that these things that many of us are facing, there are people out there who are interested not in just preventing this or covering the symptoms up or, you know, taking a drug for each thing. There's a time and a place for that, but then there's a bigger mission to live your best life, have your optimal functioning, you know, live out your years pain-free and happy and healthy. And so I think that we have similar missions in that way to be your best. So don't hesitate to reach out. We would love to, either of us would love to meet you. And please feel free to drop a comment, like, wave, tell us you're here. And thank you so much for watching. Thanks again for coming in.